We are excited to welcome you all to another inspirational and educational episode of Concorde Conversations. This is our season 2 finale. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Did you know that about 2% of all infants born in the US are conceived using assisted reproductive technology? In today's episode, Frozen in Time, we're discussing fertility preservation. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group, part of Northwell Health. And today we are joined by our outstanding colleagues from Lenox Hill, Northwell Health, and faculty of the Zucker School of Medicine at Hofstra University. I would like to introduce you all to reproductive endocrinologists at Northwell Health Fertility, Dr. Susan Maxwell and Dr. Sydney Chang. Many of our Concorde community have submitted fascinating questions to ask our experts. Remember, we are giving general guidance. If you have a particular question about your health, we want to help you. So come in and talk to our exceptional Northwell physicians so we can answer your questions and give your health the attention it deserves. Let's get started. Thank you so much, Dr. Maxwell and Dr. Chang, for joining us today. Dr. Chang, let's start with you. What is fertility preservation?
Fertility preservation is saving eggs, sperm, embryos, or reproductive tissue for later use. For the purposes of this talk, we're really going to focus on egg freezing and embryo banking.
Dr. Maxwell, why should someone consider preserving their fertility?
So there are many reasons to consider preserving your fertility. The most common reason is for women who are getting older. Both their eggs, the number of eggs in the ovaries and also the quality of those eggs decline over time. So the purpose of preserving your fertility is to extract the eggs at an age in which they are good quality, so that if you are having difficulty conceiving in the future, you have those as a backup option. There are other reasons to preserve your fertility, such as if you have a cancer diagnosis and you're going to be undergoing types of treatments that could compromise your fertility, such as chemotherapy or surgery.
Dr. Chang, what's the difference between egg and embryo freezing?
So egg freezing, we take eggs and freeze them unfertilized. So they're a single cell. And this is a really great option for women who don't have a partner. For embryos, those are going to be fertilized eggs that we fertilize with a partner's sperm and grow out to a size that's several hundred cells. So the benefits of freezing embryos is that they're hardier and they can withstand some of the freezing and thawing a little bit better. They've also gone farther in the process, so we have a better idea of what you have stored. And the last thing is that we can test them genetically to see if there's a normal chromosomal complement. And so we have a better sense of what you actually have that can be used.
Okay, Dr. Maxwell, who is a candidate for egg freezing?
The ideal time to freeze your eggs is between the age of 30 and 35 years old. And that's because we start to see declines in egg numbers and quality after the age of 35. The declines don't happen overnight. It's a gradual process. So women can freeze their eggs at any age as long as they would respond to the medications that we use for the process. In general, it's best to freeze your eggs before the age of 40.
Okay, Dr. Chang, what is ovarian reserve testing?
Ovarian reserve testing is a way that we can estimate the number of eggs that are remaining in your ovary. So there are a few ways that we do this. The first is something called anti-Mullerian hormone, or AMH, and it's a blood test that we do, and it's secreted by the cells that line the egg growing areas. So the higher the number, the more eggs you have. We want that number to be around 1 or higher for it to be normal. Some other things we can do are to count the antral follicles, or the actual number of follicles we see on an ultrasound. And the last one is to measure follicle stimulating hormone, which is another hormone that your brain makes to produce a follicle every month. So the lower the egg reserve is, the higher that number is, because your brain is working harder to mature that egg. So if that number is 10 or higher, that's usually a bad sign.
Dr. Maxwell, does ovarian reserve correlate with the ability to conceive naturally?
So, ovarian reserve does not always correlate with ability to conceive. And the reason for that is in a normal month, a woman will only ovulate one egg, regardless of her ovarian reserve. So, those pregnancy rates per month are really linked to the age of the woman trying to conceive, because that is related to her egg quality. The ovarian reserve markers we use predominantly to help us dose medications for the egg freezing process. And it does give us an indication of how many eggs you would produce if you underwent stimulation.
There's a question in the chat box. Does egg freezing decrease the chance of a natural pregnancy?
This is a great question. It does not decrease the chance of a natural pregnancy. One misconception is that by taking out some eggs, you are lowering reserve, and this is not the case. The reason for this is each month, many eggs are recruited, but only one egg will ovulate, and the others from that cycle will die off. So what we are doing is giving hormones to rescue those eggs that would otherwise be lost in that month.
So Dr. Maxwell, what is the process of egg freezing?
The process involves taking injections every day for about 10 to 12 days. And during that period of time, a woman has to come into the office every 2 to 3 days for blood work and ultrasounds so that we can monitor the progress and also adjust medications as needed. And then about 2 weeks into the process, we will do the procedure to extract the eggs. The woman gets a anesthesia through the IV so she doesn't feel anything. And then we do a vaginal ultrasound with a needle attached. And the needle goes through the vaginal wall into the ovary, and we suction out those eggs that have developed.
Okay, Dr. Chang, what are the medications that women are required to use, and what are their side effects?
In an egg freezing cycle, there are a few parts. So the first part is that we want to stimulate egg growth. And we use synthetic forms of the natural hormones that your brain is making to stimulate the growth of one egg. And we just do higher doses to recruit all of the follicles. Another thing we want to do is prevent premature ovulation. So usually mid-cycle, you'll start another medication that blocks you from ovulating. And then there's a trigger shot or two that we use to mature the eggs at the end. The side effects of these, since they're all injectable medications, you can have some bruising on the skin. Since the ovaries are growing to a size that's larger than you would normally feel, you might have some bloating and cramping. The estrogen levels are going to be elevated. And so some people experience some mood changes and fatigue, but generally speaking, it's very well tolerated.
Dr. Maxwell, is egg freezing safe in general?
Less than 1% of patients have any type of problem after the procedure. Things, risks to the process are you can get some bleeding from around the ovaries because we're poking them with a needle. The ovaries are enlarged, and so they are at increased risk of twisting with activity. So we ask our patients not to exercise for the 2 weeks of stimulation and then for 2 weeks after the retrieval. The other risk is of a condition called hyperstimulation. And this is rare, and we have lots of ways to prevent this from occurring. But it's a condition where sometimes the ovaries will produce some fluid that builds up after the procedure in the abdomen. And this can cause bloating and discomfort.
And how many eggs do you retrieve each cycle?
So that really depends on what a woman's ovarian reserve is. So the goal is to stimulate and retrieve everything that's there in a given month, but that's really going to vary a lot based on a person's antral follicle count and their age.
So, Dr. Maxwell, how many eggs should you freeze? And do you need multiple cycles?
Yeah. So when we go through one cycle of egg freezing, on average, women get between 10 and 20 eggs retrieved. I recommend that if less than 10 eggs are obtained, then they should do a second cycle because we like to have at least 10 eggs when we thaw in the future. And the reason for that is not all eggs will survive the thaw process, and then not all eggs will fertilize and continue to develop to the stage where they could be transferred. The number of eggs also depends on the age at which the person is freezing. So women who are freezing at an older age, like 38 to 40, should really consider doing more than one cycle just to increase their chances of success.
Dr. Chang, how are the eggs stored and how long can they remain frozen?
The eggs are frozen in liquid nitrogen, and we keep them on site here. They can be frozen basically indefinitely.
What is the process of thawing frozen eggs, Dr. Maxwell?
When we thaw the eggs, about 90% on average survive that thaw process. And then we fertilize them on the day of thaw. And around 70% of eggs will successfully fertilize. We then culture those fertilized eggs for 5 to 6 days in the laboratory. And on the 5th day, we would transfer 1 or 2 embryos to the uterus, and any remaining embryos would get frozen for other tries.
Okay. And when you mean culture, you mean grow the cells?
Yeah, so they go into an incubator and in media so that they can grow and develop.
Okay. Dr. Chang, what can you do to increase your chance of a successful pregnancy following fertility preservation?
So the steps you can take to increase your success after fertility preservation are basically the same as they would be for promoting healthy pregnancy, without using this technology. So things like maintaining a healthy weight, focusing on a balanced diet where you're cutting out sugar and processed foods, maintaining a healthy level of activity. So anything that promotes your general health is really going to be helpful for promoting successful pregnancy.
And it's important if you have hypertension or diabetes, those are controlled, right?
Definitely.
Okay. Are assisted reproductive technology pregnancies higher risk? And why, Dr. Maxwell?
Assisted reproductive technology pregnancies can be higher risk. Women are at increased risk of hypertensive disorders in pregnancy. A lot of times this is because the women who need assisted reproduction are often older. And this in and of itself does increase the risk of complications such as high blood pressure, preeclampsia, and diabetes in pregnancy.
Dr. Chang, do you want to discuss what preeclampsia is?
So preeclampsia is a hypertensive spectrum disorder. And so it's something that can occur in pregnancy. There are different signs and symptoms that we look out for, but essentially, it's something that you're more prone to if you're older, if you've had IVF, and something that we want to try and minimize.
Got it. So a lot of the times we'll recommend aspirin use during pregnancy to decrease your risk. There's a question in the chat box. Is egg freezing covered by insurance?
It can be covered by insurance if it's a benefit that your employer adds to your plan. So some employers are providing egg freezing to their patients as a benefit. However, the majority of patients do not have coverage for elective egg freezing. There is a New York State mandate for large group insurers to cover egg freezing for patients who have cancer, who will be undergoing treatments that could compromise their fertility. So many patients do have coverage in that scenario, but not for typical elective fertility preservation.
Okay, there's another question in the chat box. Asking if it is recommended to freeze your eggs if you're planning to conceive after the age of 35.
So this is a individual question. It really depends on the age that you are now and how long you're going to wait before trying to conceive. The a lot of women will be able to conceive on their own at the age of 35. If they anticipate that it's going to be several years after 35 when they're going to try to conceive, then it would be beneficial to freeze your eggs. The other benefit of freezing eggs is if you want multiple children. So if a woman doesn't have trouble conceiving at 35 with her first child, she may have trouble at 38, 39 as she tries to have a second child. So these eggs can also be saved for that scenario.
Okay, Dr. Chang, what if you decide you do not want to use all of your frozen eggs? What happens to them?
So that's really up to you. There are several options if you decide that you're done building your family. The most common one is you can opt to have them discarded. You can also choose to donate them for research because we're always trying to develop new technologies and ways to help women, have their families. And the last one is that you can choose to donate to another person or couple that's trying to conceive.
Okay, let's talk about common misconceptions about egg freezing. Dr. Maxwell, can you start? What are common misconceptions?
I think one of the most common misconceptions that I hear from my patients is that if they have 10 eggs frozen, that means that they have 10 babies in the freezer. And that's often not the case because of all of the developmental steps, the attrition that happens when we thaw those eggs. So from 10 eggs, that may give you a good chance at having one baby, but not 10.
The other thing I was going to add is just that, a lot of people think that they're freezing these eggs and that as soon as they want to try to get pregnant, they need to come in and use those eggs rather than trying on their own or, doing other therapies to sort of increase their chances of pregnancy if they're having trouble.
Another question in the chat box. What is the success rate with frozen eggs for someone who's in her late 30s?
So if you froze in your late 30s, then the chance of success from thawing, one group of eggs, it's going to depend on how many eggs were frozen. But from one cycle, that success rate may be around 30%. There was a recent study that came out with those numbers. But it does vary based on the individual and the number of eggs being thawed.
Is the success rate based on the age at which the eggs were frozen or the age at which the woman decides to have the pregnancy?
The success has to do with the age in which the eggs were frozen.
Got it.
Mm-hmm.
You're basically locking in the egg quality at the age that you're freezing.
Okay. And can you just discuss what is egg quality?
Mm-hmm. So egg quality means the ability of that egg, when fertilized, to produce a genetically healthy embryo. So we all have 46 chromosomes, and it's very common that when eggs are fertilized, that embryos can have either extra chromosomes or be missing chromosomes. And those embryos often do not even make a pregnancy, but they can also implant and cause miscarriages. And that's the most common cause of early pregnancy losses. And so egg quality is really the ability of your eggs to produce a genetically healthy embryo, which then can go on to have a live birth.
And there's no test for that. People say, can you test my egg quality? The best test we have for that is really your age. So there's not like a blood test we can run similar to the AMH, which just tells us about quantity. We really just go by age.
Can you test the quality of an embryo if you freeze embryos instead?
Mm-hmm. Yeah, so that is one of the advantages of freezing embryos if you have a partner, is that we can actually biopsy embryos and test them to see if they are chromosomally normal or genetically healthy. And this gives us a better indication of your pregnancy rates when we transfer a healthy embryo. The pregnancy rate from a healthy embryo transfer is approximately 50 to 60% live birth rate.
Oh, that's great.
Mm-hmm.
Okay, one last question. If you had one action step to recommend to our viewers to improve their health and start today, what would it be?
Yeah, so I recommend that if you're a woman in your 30s and you've been on birth control for a very long period of time, it's hard to know what's going on with your body and your ovarian reserve. So even if you're not sure if you want to freeze your eggs, it may be helpful to see a fertility specialist and have some fertility testing done. Sometimes we will recommend going off of your birth control so that those tests can be more accurate and we can get a good sense of your ovarian reserve, but it's good to be proactive and to know what's going on with your body so you can make decisions if needed, such as freezing your eggs.
Dr. Chang?
So, going back to what we were talking about with maintaining a healthy lifestyle, the best thing if you're considering pregnancy or trying to conceive is really to make sure that your BMI is less than 30. So I hate to harp on, weight loss, but there's good research to show that a BMI of 30 or higher is an independent risk factor for infertility, for miscarriage, and for problems in pregnancy like high blood pressure, high blood sugar. So anything that you can do, even small steps like, getting your steps in, cutting out some of those excessive sugars and carbohydrates in your diet, and just setting small goals and, being accountable to those, it's going to serve you well, not only for your pregnancy journey, but also, over your lifespan.
Yes. And decrease your cardiovascular risk as well. So, thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to Dr. Maxwell and Dr. Chang for joining our conversation. We appreciate their expertise to educate, encourage, and empower our community. As part of the Concorde community, we hope you will share in our mission. Please pass along our emails and webinar links to your friends and family. In addition, please like and subscribe to our YouTube channel. We know many of you have additional questions about your health, and we want to help you. So come in and speak to our extraordinary Northwell physicians about your health. We care about your health. We care about you. Thank you so much and happy holidays.